8:55, 95.3 WBCK in November, which starts next week. Mind you, it's National Diabetes Awareness Month. And in our Ask the Expert segment to talk a little bit about that is Tina Guajardo, a registered dietitian and clinical nutrition specialist at Bronson Battle Creek Diabetes Center. Hi, Tina.
Hi there.
So what is diabetes anyway?
Yeah, so diabetes is a group of diseases that occurs when the blood glucose or sugar is too high. Blood sugar is our main form of energy and comes from the foods we eat, specifically carbohydrates. Insulin, produced by the pancreas, helps get that sugar into our cells to provide us energy. However, if your body does not produce enough insulin, or if the insulin cannot work effectively, then the sugar stays in the bloodstream and is not able to get into our cells to provide us energy, which leaves us with a high blood sugar.
So common risk factors then for what's considered to be type 2 diabetes, what would those be?
Yeah, some common risk factors for type 2 diabetes is being age 45 years or older, having a family history of diabetes, being overweight, being physically inactive, and for women having a history of gestational diabetes.
So how do we know if we are diabetic? Are there specific symptoms?
Yeah, so there are specific symptoms for high blood sugar, which at times can be the main indicator for diabetes. And those symptoms include increased thirst and hunger, frequent urination, feeling fatigued or exhausted all the time, and even blurry vision.
So if it's not treated, what are the complications, Tina?
Yeah, so there are potential complications for uncontrolled diabetes, such as kidney damage, eye problems, and nerve damage, just to name a few. However, diabetes is manageable through blood sugar control, regular physical activity, medications, and healthy eating. And those few things can greatly increase or decrease your risk of having complications of diabetes.
Okay, so at Bronson Battle Creek Diabetes Center, what do you do there? What resources are there?
Yeah, we have many resources available at Bronson Battle Creek Diabetes Center. We offer diabetes education classes, which are taught by a nurse and myself, the dietitian. We offer morning, afternoon, and evening classes. We have one-on-one nutritional counseling. We also offer a diabetes support group, which is held every third Thursday of the month from 9 to 10 o'clock in the morning. We are also offering a foot clinic in conjunction with our wound center. And our next day for the foot clinic is going to be November 10th. Appointments are required for that if anybody is interested. We also developed a new walking group, which is meeting at this time on the second and fourth Fridays of every month at 8 o'clock in the morning. Weather permitting, of course, we're meeting at Riverside Park. And if there is any precipitation, we will be meeting at Lakeview Square Mall in front of the Barnes & Noble. And our last edition that we are just offering are the grocery store tours. And our next date for that is November 3rd. It's going to be at 10 in the morning until noon. And it's going to be at the Family Fair on Columbia Ave. Registration is limited, so we do encourage a call for that, too.
And that is meant to try and help folks make the right choices in the store,
Yes, absolutely. Yeah. And we're having a holiday edition for the November date. So, you know, how to prevent holiday weight gain and maybe make holiday recipes a little healthier.
All right. Well, Tina, thank you for telling us about that. If you'd like to make an appointment at the Bronson Battle Creek Diabetes Center, all you have to